So welcome to our conversations today. And remember, this is our Cultivate page where we talk about several aspects of life, but then go very big on the aspect of parenting. And today we're going to talk about something we call ADHD. ADHD in full is Attention Deficit Hyperactivity Disorder. So it's a condition. But before you go any further, make sure you like, subscribe, and tune in so that we can actually have this conversation to the fullest. And so this is where we begin. Why talk about ADHD? This is a conversation that actually has been inspired by a parent who actually had some questions regarding the topic ADHD. And the most predominant question that this parent asked was, why is it that children diagnosed with ADHD never seem to actually listen and follow the instructions that they are given? And before we go in further into actually looking at what ADHD is, let us start from here as parents. The fact that a child has been diagnosed with ADHD, that means this child is dealing with a condition. A child dealing with a condition needs care and needs treatment. And it's not only ADHD, there are several conditions that affect our children, which will actually be talking about them in several other videos. These conditions affect our children, and when our children are affected, then it means an affected child is not going to perform to the same level with other children. So as a parent, let us not place or put unrealistic expectations to a child who's been diagnosed by ADHD, or rather a child who has been diagnosed by any other developmental condition. Because from that point, we have to understand that a child diagnosed by any condition means they need care and they need treatment for that condition that they're dealing with. Good. Having understood that as your role in this, then let us actually look at what ADHD is. We said it is Attention Deficit Hyperactivity Disorder. This ADHD is a neurodevelopmental condition, meaning it arises from brain development. And when we are actually trying to assess ADHD in children, there are several characteristics that we actually focus on, because this condition presents in those particular characteristics. Number one is inattention. That is one of the characteristics that presents in a child who have ADHD condition. Number two is a characteristic that we normally say hyperactivity or impulsivity. This is a characteristic that actually presents in a child who have Attention Deficit Hyperactivity Disorder. And so these are the two main things that we focus on and try to see or assess whether the child meets a criteria to be diagnosed with Attention Deficit Hyperactivity Disorder. And so having talked about these two characteristics, so you'll find that this condition will actually come in several forms. The first form of this condition is where a child has symptoms that are predominantly inattention. And then the second one is when a child presents with characteristics that are predominantly hyperactive or impulsive. And then the third one is when a child presents with characteristics or symptoms that actually takes both aspects equally. So we can have a child who has symptoms that are both inattention and also hyperactivity symptoms or impulsivity symptoms. And when we look at these aspects, we then ask ourselves, when we say it's predominantly inattention, what are we looking at exactly? In predominantly inattentive aspect, a child will present with things like forgetfulness, easily distracted, and difficulty focusing. Those are the things that we'll be looking at when we're looking at a child who actually presents with symptoms that are predominantly inattentive. And then when we talk about symptoms that are predominantly hyperactive or impulsive, then you'll find things like restlessness, excessive talking, and impulsive decision making. So those are some of the things that we'll be looking at when we actually look at the aspect of symptoms that are predominantly hyperactive and impulsive. But then, like I've said, you can find that a child presents with symptoms that are both hyperactive and impulsive and also inattention. So those are the things that we are actually going to look at when we are trying to assess a child who has ADHD. So having talked about those characteristics that we actually look at in these children, you can actually tell what symptoms are you likely to find in a child that presents with ADHD. So the core symptoms are symptoms like trouble staying on one task, losing things, forgetting daily activities, constant movement, fidgeting, inability to stay seated in one place, things like acting without thinking, interrupting others, and having poor self-control. So those are the symptoms that in most cases are actually presenting complaints when parents actually bring their children to the hospital or to the professional for them to be assessed of this condition, ADHD. So having understood all these things about ADHD and some of the core symptoms that will present in a child, I want to actually make this message clear to all the parents that unless your child has been diagnosed by a professional, then to not assume your child has ADHD. Assessment and diagnosis is only done by professionals, not assumptions by parents. And so if a child presents with any of these symptoms, then please make sure that you take this child to a professional so that they can have a proper diagnosis. This is, I'm actually making sure that parents get this message because I've encountered several parents saying that my child has ADHD. But when you ask a parent, then who diagnosed your child with ADHD? The answers are almost the same. I have seen this child having these symptoms. But then when you look at those symptoms, sometimes children can present with them. But that doesn't mean they necessarily have ADHD. When you go to a professional or in a hospital, we have actually criteria that we are going to follow so that we make sure that when you are making this diagnosis, then it is the right diagnosis. And just like I said, there are several developmental conditions that affect our children. And so misdiagnosis will actually make you mismanage your child. So always make sure that we are getting diagnosis from a professional so that we take good care and actually necessary care for our children and not misdiagnose and then end up providing care that is not actually needed by our children. So, as a parent, we have to understand that children who have been affected by this condition called ADHD will have difficulties in their life, difficulties with their attention, difficulties with how they relate with others, difficulties staying on one single task, difficulty sitting in one place. They'll have forgetfulness. They'll have challenges with their assignments, with their schooling because of what they are dealing with. And just to put this into perspective, ADHD doesn't mean a child has an intelligence problem. ADHD means a child is dealing with challenges of inattention, impulsivity, that is brain regulation. So it doesn't mean your child has a challenge with intelligence. A child has a challenge with brain regulation. Let us be clear on that. And so some of the challenges that the children will be having are the ones that we've mentioned. Challenges with doing their task to completion, challenges with focusing and concentrating on some things, challenges of making decisions because they'll make irrational and impulsive decisions. So all these challenges will now be upon you as a parent to intervene and make sure that you are providing proper care to this child. The care that will help this child deal with those challenges to a point that they can still function well in school and in society. And so, what are the things that you as a parent are supposed to actually focus on and make sure that you are helping these children? Number one thing is, as a parent, you have to understand that this is a condition that the child is dealing with, and therefore they need care and not punishment. Because in most cases, these behaviors that are actually exhibited by children with ADHD are seen as bad behaviors. Sometimes laziness. But then, that is not the case. We've seen it's a challenge of brain regulation, where a child will now have challenges with inattention, hyperactivity, or impulsive challenges. And so we have to understand that as a parent, care will be very, very important as opposed to providing discipline day in, day out to this child. Because with discipline, this child is never going to change because they're not doing it willingly. They're doing it because of the challenge that they have. And so care will be important and not discipline day in, day out. Number two, we have to actually lay certain parental foundations for these children so that these children are able to function within these foundations. Example of these foundations are, as a parent, you're actually to clearly define daily routines for this child. So make sure that you have daily routine for this child because of the challenge that we're having. Remember, we've talked about challenges with attention, forgetfulness, decision making. And so routine is going to actually help this child go through the day. Apart from routine, another thing that we are actually supposed to be making sure that we do as parents is providing visual schedules for these children. What do I mean a visual schedule? It can be a written schedule. Simply put it, a timetable of what things this child is supposed to be doing. Because telling them, because actually telling them with the word of mouth is going to be tricky for them. because of the challenge that they are having. So if we keep telling them that today you are going to do 1, 2, 3 things, then there are higher chances they're going to forget whatever that you said. And then they're not going to be able to complete that task. And so make sure that we're actually providing visual schedule to these children, something that they can keep on coming back to refer to. And then number 3 is let us give shorter instructions. Shorter instructions in relation to actually dividing the task into shorter things so that children are able to finish them. For example, do not tell your child to clean their room. They're not going to be able to manage to do that. Rather, break this into simpler things. Tell your child, fold your clothes and arrange them. Make your bed. Clean your window. Those things are technically adding up to a clean house. So rather than telling them clean the house, let us give them these simple tasks so that they can finish one task, move to the next task, and then at the end of the day, they have completed that task that they are doing. And then another thing that we can actually make sure that we are focusing on is making sure that we create predictability within the day. Creating predictability for these children help them actually keep on telling their mind that when we come from this thing, we are going to this next thing. So the day becomes predictable to them. And that one helps them to actually control themselves and go through these tasks. And this predictability can be brought by what you've mentioned earlier, having routines and making sure that we have visual schedules for these children so that they can actually know what is coming next for them. Make the day predictable for them. And this helps them actually manage themselves. Of course, with your help. You're not going to do all these things and then disappear from the picture. You're going to do all these things, but they stay in the picture to make sure that we are supporting them, we are moving them, and then we are guiding with them. We are guiding them. When the third thing of what a parent should actually focus on to make sure that we are helping these children who've been diagnosed with ADHD is that we actually make sure that we're teaching them emotional regulation, how they actually deal with their emotions and regulate them. And for this aspect, we are going to actually focus on teaching emotional regulation to those children. So from simple things like breathing techniques, let them understand those aspects of emotional regulation. Things like having a break and making sure that you recollect yourself, regulate what is happening, and then move on to the next task. Things like having a healthy expression of emotions, expression of frustrations. These are the things that we are going to make sure that we teach these children every day so that they are able to regulate their emotion. Remember, we talked about these children going through or dealing with brain regulation challenge. And so making sure that we teach these children emotional regulation is going to be a very important aspect for their development as they go through everyday experience. And so, as a parent, having understood those several aspects that we are actually going to make sure that we do to help these children go through life as others, the goal is not to actually get them to be perfect. The goal is to help them regulate themselves, to help them have that resilience, and to help them create that confidence so that they can be able to coexist with other children and be productive in the society. So do not aim at getting a perfect child. Aim at making sure that your child is performing well in school, your child is performing well in life, and your child is being productive in society, not for a perfect child. Focus on the positive aspects of this child, on the thing that this child can do best, and then help them develop regulation and do what they can do in the best way possible. So thank you very much for having this conversation. And thank you to that parent who actually brought about this question and making us to have this conversation. So as a parent, always know that we are supposed to give our best, our very best, when we're actually looking after these children who have been diagnosed by ADHD conditions. And not only ADHD, all other conditions that affect our children. And remember, let us not assume that we actually know our children have certain kind of conditions. Let us use professionals. Let us allow professionals to do these assessments and give us the best possible ways of how we are going to manage and provide care to these children. Thank you very much and see you in our next conversation.